Imaging Studies for Physical Therapists, Part 4, Cross-Sectional Anatomy. Imaging modalities such as CT, MRI, and sonography require the technologist to look at anatomy in cross-sectional planes. The three major imaging planes are axial, coronal, and sagittal. The axial plane is sometimes referred to as a transverse plane. If we were in class together, I would have you fill in the blanks for me and tell me more about this. Since we've already gone over it, we'd just be reviewing it at this point. But it divides the body into superior and inferior portions. CT images were originally in the axial plane and only in that plane. But after we started doing volume or multi-slice scanning, also called spiral scanning, we were able to reconstruct those images from the axial plane into other planes such as coronal, sagittal, and oblique planes. To view the images, we're looking at this image as though we're standing at the patient's feet and looking toward their head. So their right is on your left and their left is on your right. The superiormost aspect of this image is their anterior surface, and the bottom of it is their posterior surface. The coronal plane divides the body into anterior and posterior portions. It's viewed similar to radiographs, that if you are imagining you're facing the patient, so the patient's right is on your left and vice versa. And finally, the sagittal plane divides the body into right and left portions. CT images have density similar to radiography, where bone and other dense structures such as radiopaque contrast media, which we use barium or iodine, appear white. Air and other low-density structures appear black or dark. The fat, the organs, muscle, etc. appear in varying shades of gray. A couple items about MR images. The structures that generate a strong signal are lighter gray or white. Structures that do not return a strong signal tend to be darker. There are things to consider with regard to signals, because we could look at T1 or T2 weighted signals, and we are also looking at diffusion studies, which are a T2 weighted image. We stayed away from the remainder of them just to kind of simplify MRI a little bit. The contrast media we use in MRI is not iodine or barium, but rather is gadolinium, and it can be used to enhance signal intensity. Localizer images are for use of letting us know the position of the imaging plane in each section or each slice that we're going to be taking of our patient. Notice in the CT localizing image that we're looking at a lateral skull radiograph. Well, one reason is because in CT, just like in radiography, we're using X-rays. In MRI, we have no option for taking a radiograph because we're using a magnet and radio waves and have no X-ray source available to us. So it's a sagittal plane that we're able to visualize right now. The localizer image is going to identify that level at which we're taking a slice. And in each of these images, we happen to have 7 lines, but usually the CT and MR tech have a lot more than that. We're going to image more superior than what we're at right now, and we're going to image a little slightly inferior to that as well. If an CT or MRI technologist sees something on an image that they notice might be important to go ahead and add some additional lines to image in a patient, they can add those as they're scanning our patients. That's frequently performed if they're performing an abdomen and they notice something coming up. They can go ahead and continue scanning through the pelvis if need be. When you're looking at these lines, they're approximately parallel to the orbital or infraorbital meatal planes. Physical therapists have an extensive knowledge and background with anatomy and physiology, but the gross anatomy that we normally think of appears differently when it's in cross-sectional images. So the purpose of this section of Part 4 is to look at multiple images in multiple planes of each body part. In Level A, we're taking a look at the line drawings on the left and then the images on the right. And to start off with, we have the falx cerebri, the frontal lobe, the corpus callosum, the right and left parietal lobes, the parietal bone, and the frontal bone. In level B, we'll start off with the genu of the corpus callosum, the lateral ventricles in their entirety, the choric plexus, which to me kind of looks like snot, the splenium of the corpus callosum, the falx cerebri in a longitudinal fissure, the parietal bone, and the parietal lobes, the frontal lobes, and the frontal bone. In level C, we're going to start off by looking at the frontal lobe, the anterior horn of the lateral ventricle, the head of the caudate nucleus, the temporal lobe, the third ventricle, cerebral aqueduct or aqueductus sylvius, which kind of looks like a smiley face, and the cerebellum. Level D kind of reminds me of a starfish, but starting off with the frontal lobe, the middle cerebral artery, the anterior cerebral artery, interpeduncular cistern, the basilar artery, the pons, mastoid region of the temporal bone, the temporal horn of the lateral ventricle, the fourth ventricle, and the cerebellum. Moving on to level E, greater wing of the sphenoid bone. Notice how white it is. Sella turcica, the temporal lobe, the basilar artery, Petrus ridge of the temporal bone, the auricle of the external ear, the mastoid region of the temporal bone, the pons, the cerebellum, and finally the fourth ventricle. On level F, we're going to start with the frontal sinuses. Remember that air has the appearance of being black or dark gray on radiographs and also CT images. The frontal lobe, the greater wing of the sphenoid bone, the optic foramen, the temporal lobe, the basilar artery, the pons, the cerebellum, and the Petrus ridges of the temporal bone. Level G, the frontal sinus again, but we're seeing more of it, so it's a larger area, but still in black. The orbit, the sphenoid sinus, which we know is posterior to the frontal sinus, the temporal lobe, the external auditory canal, the medulla. Notice we've gone inferiorly enough where we've left the pons and we've moved into the medulla. The cerebellum. Here's a localizer image for the sagittal planes. At this time we're looking at an AP projection of the skull, and we'll look at 3 images in this plane. Level A is the mid-sagittal plane. Starting off with the parietal lobe, the corpus callosum, the frontal lobe, the lateral ventricle, the frontal sinus, ethmoid sinuses, sphenoidal sinuses, the pharynx, the tongue, the medulla, the pons, cerebellum, the midbrain, the occipital lobe, and the superior sagittal sinus. And we'll take a look at all these on the next diagram. So here's level A, and we're just going to diagram these on here, starting off with the parietal lobe, the corpus callosum, the frontal lobe, the lateral ventricles, frontal sinuses, ethmoidal sinuses, sphenoidal sinuses, the pharynx, the tongue, the medulla, the pons, cerebellum, the midbrain, the occipital lobe, and the superior sagittal sinus. Level B is a sagittal plane as well, sagittal slice. We'll take a look at a couple of these structures. Just the lateral ventricle, the cerebellum, the tongue, and the cervical vertebra. Here's the image. The lateral ventricle, the cerebellum, which kind of looks like cauliflower, and the cervical vertebra. Level C. In level C, we see the parietal lobe, frontal lobe, temporal lobe, the optic nerve, maxillary sinus, fourth ventricle, cerebellum, and the occipital lobe. So here we go with the actual drawings. We have the parietal lobe, the frontal lobe, the temporal lobe, the optic nerve, the maxillary sinus, fourth ventricle, cerebellum, and the occipital lobe. This is our last localizer image for the skull. We're going to be looking at the coronal plane and looking at three lines, A, B, and C. At level A, we're looking at first the falx cerebri, then the corpus callosum, the lateral ventricle, and we'll skip around here to the sphenoid sinus and the third ventricle. At level B, we're looking at the lateral ventricles, the temporal bone, C1 and C2, the third ventricle, the external acoustic meatus, or EAM, and the parotid gland. In level C, we're looking at the most posterior slice. We've got the corpus callosum, the fourth ventricle, the cerebellum, and the lateral ventricles. We're taking a look at the pharynx, the tongue. The epiglottis is really well visualized. We can see the trachea well visualized, the manubrium, C2 vertebra, the spinal cord, intervertebral disc, and the aortic arch. Here's our next localizer image. We're taking a look at slices A through G and looking at axial slices of the chest. Since we're starting up in level A, we're going to have a cervical vertebra on our first image, and as we're going down through these particular localizer images, you'll be looking at slices or sections of the heart. Starting off with level A. In level A, we start off with the trachea, the acromioclavicular joint, the spinal cord, the esophagus, acromion process, the humerus, and the clavicle, as well as the thyroid gland. We're at the level of T2 vertebra, so we can look at the lung, the pectoralis major and minor, the humeral head, the acromion, the trapezius muscles, the esophagus, supraspinatus muscle, scapular spine, the infraspinatus muscle, the subscapularis muscle, the rib, and the trachea. We're at the level of T2. We have the trachea, the lung, pectoralis major and minor, humeral head, the acromion, trapezius muscles, esophagus, supraspinatus muscle, scapular spine, infraspinatus muscle, subscapularis muscle, the rib. At level C, we're looking at the pectoralis muscles, the rib, subscapularis muscle, the scapula, trapezius muscle, trachea, the esophagus, the manubrium, and the sternoclavicular joint, as well as the lung at the level of T3. At level C, we have the pectoralis muscles, the rib, subscapularis muscles, the scapula, trapezius muscle, the trachea, the esophagus, manubrium, sternoclavicular joint, the lung, and we're at the level of T3. At level D, and we're at the level of T4 with this image. The pectoralis muscles, the subscapularis muscle, the scapula, trapezius muscle, the esophagus, and the trachea, the rib, the aortic arch, and the manubrium. One thing to keep in mind with these structures is that lung and the trachea, which have air, are going to be black. As we talked about before, your muscles are more gray, and then any item that's going to have contrast medium or bone is going to be white, to kind of keep you up with the, that idea of what structures or types of structures at which we're looking. Looking at level D, we have the superior vena cava and the aortic arch, which are white because they're filled with contrast medium. The manubrium is white because it's bone. The pectoralis muscles are gray. Subscapularis muscle, we've got the scapula. Trapezius muscle, the lung of left and right lungs, of course, are both black. The esophagus, we can visualize the trachea, the rib, the aortic arch, and the manubrium. At level E, kind of looks like we got a couple eyeballs. The eyeballs are the right and left main bronchus. So starting off with the sternum, that's the most anterior aspect of our patient. Then we have the ascending aorta, the pectoralis muscles, the superior vena cava, the right main bronchus, the esophagus, the descending aorta, the left main bronchus, the pulmonary trunk, the sternum, and the ascending aorta. I thought I'd put a picture of the heart and then compare that with a PHS radiograph as well as the lateral on the next slide, and then we'll take a look at the heart from the axial plane. So looking at the heart on a PA and lateral chest radiograph is a little bit different than looking at just the heart by itself. Notice we have the ascending aorta, the right atrium, the right ventricle, the left ventricle, the left atrium, the pulmonary trunk, and then the aortic knob on the PA chest radiograph. On the lateral, we can see the aorta, the right atrium, the right ventricle, the inferior vena cava, the left ventricle, and the left atrium. If a patient were to have an enlarged left ventricle or any condition of the heart like congestive heart failure, we're going to see a different appearance from what we're seeing here on a patient with negative findings. Now let's take a look at the axial plane. The first thing we're going to do is kind of go out of order with this image, because one thing that helps us divide the heart or look at the heart are the septums. The interventricular septum. What does the interventricular septum divide? It divides your two ventricles. So here's the right ventricle and here's the left ventricle. So if those are the ventricles, where are the atria? Well, the right atrium is over here. And here's the left atrium. So when you're looking at this, keep in mind that we're looking from the bottom up at the heart. It's not exactly how you would think it would appear on an axial image. We have the descending aorta here. And then of course we got the right lung and the left lung. A couple other things to look at. We've got the esophagus, the latissimus dorsi muscle, and the sternum. At level G, we've gone toward more inferior, so you're still going to see the ventricles. We've lost the atria in this slice. Here's the interventricular septum, the left ventricle and the right ventricle, the sternum, the inferior vena cava, the aorta, the right and left lungs, the esophagus, and the liver is the first time it appears for us is on this slice, and the latissimus dorsi muscle, and of course the sternum. Here's another localizer image. It's looking at an AP projection of the chest, and we're going to be dividing the patient into the sagittal planes and just looking at 3 of them. So at level A, we're looking at the mid-sagittal plane with the trachea, the esophagus, the manubrium, the sternal angle, the aortic arch, the ascending aorta, the body of the sternum, the left atrium and the right ventricle, the left ventricle, the diaphragm, the liver, and the intravertebral foramen. At level B, we're still seeing the trachea, the left clavicle, because we're now not in the mid-sagittal plane, we're just in a sagittal, the left common carotid artery, the esophagus, left subclavian artery, aortic artery, left pulmonary artery, left main bronchus, the ascending aorta, the left atrium, the right ventricle, and the left ventricle, and the descending aorta. And finally, level C. The rib, left clavicle, left sternoclavicular joint, the manubrium, left subclavian artery, pulmonary artery, pulmonary veins, the left ventricle and the right ventricle, and the left atrium. And here's the last localizer image of the chest. We're dividing the chest into coronal planes, and we're looking at the levels of just A, B, and C at a lateral chest radiograph. Here's the clavicle, the manubrium, a rib, ascending aorta, the superior vena cava, the right atrium, and the right ventricle. At level B, we have the trachea, the left clavicle, the left axillary artery, the brachiocephalic artery, left brachiocephalic vein, superior vena cava, aortic arch, pulmonary artery, the right atrium, and the right ventricle. And level C, the esophagus, the left subclavian artery, the aortic arch, the trachea, the bifurcation of the right main bronchus, and you can also see the left main bronchus, the right pulmonary vein, the left atrium, and the descending aorta. Another localizer image now is of the abdomen, and slicing down, starting out the diaphragm, level the diaphragm, and going through the pelvis. In level A, we can see the esophagus, the xiphoid process, the liver, the latissimus dorsi muscle, the inferior vena cava, the aorta, the diaphragm, and the apex of the heart. At level B, we again can see the liver, and of course there's many parts of the liver: the aorta, the lung, latissimus dorsi muscle, the spleen, the stomach, the greater omentum, diaphragm, external oblique muscle, and the rectus abdominis muscle. In level C, we're looking here at the stomach filled with barium, and then the most anterior aspect of it is the fundus, which has air. Since the patient is lying on their back, we can see the air fluid level separating from air and the barium. In this image, you can see the liver, the latissimus dorsi muscle, the inferior vena cava, the aorta, the spleen, kind of looks like a boomerang, the greater omentum, and the rectus abdominis muscle. At level D, again we can see the liver, the stomach, the rectus abdominis muscle, the right adrenal gland, the inferior vena cava, the aorta, the left adrenal gland, the pancreas, which looks like a cob of corn, the spleen, the descending colon, and the transverse colon. At level E, we can see the gallbladder, the pancreas, the right adrenal gland, the inferior vena cava, the aorta, the left adrenal gland now looks like a Y, the spleen, the descending colon, the transverse colon, the small bowel, which is kind of feathery, and the stomach, as well as the pyloric canal. At level F, since we keep moving inferiorly to the patient, we're finally reaching the most inferior aspects of the liver. On the previous two slices, you saw the adrenal glands, so now we can see the kidneys. Starting off with the liver, we're just looking at the right lobe of the liver, the hepatic flexure, the inferior vena cava, the aorta, the left and the right kidneys. The spleen is nearly gone. We're just looking at the most inferior aspect of the spleen. The descending colon, the transverse colon, the duodenum, and the head of the pancreas. Level G is the transverse colon, where we can see the air fluid levels with the air in the barium, the ascending colon, the inferior vena cava, the aorta, the left kidney, and the descending colon. At level H, we have the ileum of the small bowel, the ascending colon, the ileum of the pelvis, the ureter, psoas muscles, descending colon, and the small bowel. At this level, we're looking at the descending colon, the small bowel, the external oblique muscle, the internal oblique muscle, the transverse abdominis muscle, the gluteus medius muscle, the gluteus maximus muscle, the psoas muscles, the sacrum, the sacroiliac joint, the ileum of the pelvis, and the iliac muscle. At level J, we're looking at the rectus abdominis muscle, the small bowel, the sigmoid colon, the gluteus minimus muscle, the gluteus medius muscle, the gluteus maximus muscle, the uterus, the sacrum, the rectum, a ureter with contrast media, the sciatic nerve, the ileum of the pelvis. At level K, it looks like a Hershey's kiss. The bladder is what looks like the Hershey's kiss. It has contrast media in it. We're looking at the gluteus maximus muscle, the ischium, the rectum, the cervix, the sciatic nerve, the greater trochanter, femoral head, the femoral nerve, femoral artery, femoral vein, and the pubis. This is another viewpoint of level K, but in a male patient. The ischium, the rectum, the coccyx, the urethra, sciatic nerve, gluteus maximus muscle, the greater trochanter, the femoral head, the femoral artery, the femoral vein, and the pubis. Now we'll take a look at the mid-sagittal plane in both a male and a female, and the first one we'll look at is a female. Starting off with L4 and L5, as well as the sacrum and the coccyx. Anterior to the sacrum is the rectum, anterior to that is the uterus, and anterior to that is the uterine cavity. Anterior to that is the bladder, and then the pubis. And the rectus abdominis muscle is the most anterior aspect of all. In the male patient, we can visualize the aorta, the rectus abdominis muscle, the bladder, the pubic bone, the testicles, the prostatic urethra within the prostate, the coccyx, the rectum, the sacrum, L4, and the cauda equina.